Hello, we've got lots of people joining. Welcome. Thank you for joining us today. I think we should make a start because we have a lot of amazing expertise to hear about around antioxidant-rich prenatals supporting fertility, natural conception, assisted reproduction. So I'm going to just introduce our panelists this evening. So most of you will know me, I'm Eloise. I am the CEO and founder of Fertility Help Hub, which is a global lifestyle platform supporting over 200,000 people around the world who are struggling with fertility in different ways. My husband is infertile due to having Klinefelter syndrome and azoospermia. So we have 3 sperm donor conceived children, thanks to experts in New York. And the first guest I'd like to introduce this evening is Dr. Agarwal, who is the director of the American Center for Reproductive Medicine at the Cleveland Clinic. He is the top author on andrology in the world and male infertility, and has a special interest in antioxidant support. So welcome to you this evening.
Thank you very much, Eloise.
And our other panelist this evening is Dr. Ritz, and he is the medical director at Elite IVF. He trained in the UK, in Cambridge and London, under Professor Edwards, and he has a particular interest in successful IVF and reproductive solutions, and also in antioxidant therapy, which is why he's here this evening. And of course, thank you so much to Fairhaven Health, who are sponsoring the event tonight, who will be answering all your questions live about what to look for in supplements, what to try, when to start, etc. So any questions, please ask any of us as we go through. So if we start with you, Dr. Agarwal.
Okay, thank you very much, Eloise, and hello to everyone out there listening to this special webinar. Very pleased to be here talking about the things related to antioxidants and how our work and others have shown that it can support a variety of things related to fertility health. I just wanted to tell you about what are some of the major reasons for male problems of fertility. This is very important for everyone to know, because fertility in a couple is a problem of both male and female. From the scientific studies and clinical practice, it has been shown that about half of all the problems that are there in the couple are due to the female related causes, where it could be tubes, the eggs, there can be blockage, all kinds of things, the age. And the same thing goes for the rest, for the male. About half of the causes are directly due to, at least 30% of them are directly due to the male, and in other 20%, it is both and male and female factors are involved. So it is important to recognize that the problems are not 100% or always due to the female, and that is one of the issue that remains unresolved or is still quite unclear among a large population of people around the world. If you look at this chart, you will see about 100 million men around the world are having problems of fertility. And it is a worldwide issue, not only for the Western countries, but in all continents, all parts of continent, the problem of male infertility exists. And the main issues which really leads to this is essentially the older age, which is a common issue these days. For the last 30, 40 years, we are having the delays in the young people getting married. I mean, earlier it used to be about 20, 30 years ago that at the early age of 20s or mid 20s, the male and female, the man and woman will start building a family together. But that has changed. That has changed. If you look at now, a lot of people, of course, are not marrying, but those who are, I mean, it is very common to see that they are going into early or mid 30s or even early 40s. So that has really affected the quality of their fertility, both on the male as well as in the female, where things are very, very clear. And there is a very high rate of sexually transmitted disease among the among the men and women in the reproductive age in men. And then there is a lot of environmental causes, which we all understand is there is one chemical called phthalates. It's in every place in our kitchen. It's called a forever. It really is in our every product that we have in our kitchen, and anything that we touch has phthalates, and all of these have a long-term effect on our health as well as on our reproductive health. Lifestyle factors, obesity and cell phone use, the stress, the alcohol, smoking, these are things which we are all familiar, but they do have effect on the reproductive system significantly. Diabetes, erectile dysfunction. So there are many things within our fertility which can be medically treated. There are many on the male side which can be surgically treated. There are several surgical procedures that are very successful. And then there are environmental causes which can be corrected by changes in our lifestyle and various kinds of medications. So the fertility in the male is correctable. It can be improved. It can be done in a way which will allow the couple to have their own natural biological child. So I want to tell you about this phenomena called oxidative stress. You may or may not have heard of it, but just to simply put what it is a condition which happens when your antioxidant levels are low. And these levels can be measured in your blood, in your bodily fluids, seminal fluid, follicular fluid. And if there is an imbalance between the reactive oxygen species or oxidants and antioxidant, this leads to oxidative stress. This is very important for you to understand. And a large number of between 30 to 80% of men who are infertile have high levels of these harmful molecules. And this is a potentially treatable condition. This is important to know that at this time, in terms of patients who have oxidative stress or other unknown causes, there is not a clear-cut treatment modality, how to treat those men. And that number of such men who have what we call as idiopathic or unknown causes is almost as much as 50% of all men with infertility. So it is important. So here, antioxidants can be very helpful. So I want to tell you about antioxidants. This is one of the books that we published several years ago. But here you will see a large number of studies that have been published, which really provide support in favor of use of nutraceuticals for treatment of male fertility. These are just a few of the examples, and there are more. These are called double-blind randomized control, which is the highest quality of studies which have been conducted, and all of them and all of these studies show significant improvement in the quality of reproductive health in semen quality and fertility of men. And there is a lot of disinformation and information which is not true, that there is antioxidants are not effective, they don't work, but all of that is really not supported by good science. There is a lot of good research, there is a lot of clinical trials which have been conducted, which show that antioxidants play a significant, important role in a large number of patients with unknown causes of male infertility where they have high levels of oxidative stress. So what are the benefits of antioxidants? They really are important to treat the patients with oxidative stress. And generally, they are use of this can avoid the high cost of assisted reproductive treatment for such selected population of men where a IVF or ICSI is really not indicated. And the antioxidants in general are safe, cheap, and commonly available. So this is an example of a study which is called a meta-analysis that we have been conducting and preparing it for publication in the next day or two. And this is a huge meta-analysis that we had done. And I will show you the results of this study. And these are the results. This is the data which shows the clinical pregnancy rate, which is really a very important part of the results of any kind of therapeutic intervention. And you can see that the clinical pregnancy rate improves significantly after treatment of patients from large number of studies, including thousands of patients, shows significant improvement, clinical pregnancy compared to no treatment. So this is important. Also, all the important parameters of the sperm, such as motility, increase significantly, and oxidative stress levels have gone down significantly after treatment. So the antioxidants really have a lot of scientific data, which really shows that there is a great deal of promise while there is a lot of confusion, and a lot of physicians and who are really are not clearly informed. They have not really been well educated about the benefits of the antioxidants. So the antioxidants can be helpful for men in various conditions, patients who or couples who have repeated IUI or IVF failure, patients who have a clinical diagnosis of varicocele, older men, history of infection, genital infection, history of smoking, patients with male infertility with idiopathic or unknown causes, and patients who have couples who have recurrent spontaneous abortion. I wanted to talk to you about a clinical trial that we conducted recently. And this is a clinical trial with about 150 men with idiopathic infertility. They were given antioxidant for 3 months. And we tested them for all the important semen parameters and sperm DNA fragmentation and oxidative stress. And these men were treated with FH Pro for men. As you can see, it is really a very well-made compound, which is made in the United States. And it is made in a GMP certified lab. And it contains a variety of scientifically proven ingredients, the vitamins, the cofactor, the amino acid, and many others. So this is really not a run-of-the-mill type of antioxidant that you can buy from anywhere and everywhere, but it is a specially prepared antioxidant which involve the expertise of a variety of experts who created this antioxidant after a long time of research. So here are the study population which we had idiopathic or unknown male infertility patient with confirmed oxidative stress. And what we found is fantastic results. There is a significant improvement, almost 55% improvement in the density of the sperm or the number of the sperm, almost a significant 16% improvement in motility, and almost 143% improvement in progressive motility. These are the quality of the sperm which move very fast and they can reach the egg. Then we looked at And these are the results further on. As you can see, there is a significant improvement in morphology, which is really the shape of the sperm. The normal oval shaped sperm increased almost 86% after 3 months of treatment with antioxidant, and the harmful oxidative stress or reactive oxygen species decreased, and the sperm DNA fragmentation in the sperm also decreased significantly. So these are the antioxidant like FH Pro can significantly reduce the high level of sperm DNA fragmentation, which is one of the causes of reproductive failure in IVF as well as in ICSI, less so in ICSI, but more in IVF and in natural pregnancy. Another study that we conducted was on a study which was conducted here at the Cleveland Clinic in our program, where we looked at the proteins which are modulating, or which are really the reasons why the sperm move or why they fertilize. So we looked at the molecular machinery of the sperm after giving these men antioxidant FH Pro. And this is the study design, where we treated these men for 6 months or asked them to take antioxidant FH Pro. And we found a significant improvement. As you can see here, our study found that sperm protein, there are 4 or 5 proteins which were significantly changed. Either they increased significantly or they decreased. The ones that increased really are the trigger or controller for movement of sperm motility or their fertility, and the proteins that decreased are the ones which really increase the oxidative stress. So this is something that has never been shown, and it provides the molecular basis for why an antioxidant such as FH Pro is so effective, so efficient in improving the quality of sperm as well as fertility of male patient who take antioxidant. So oral antioxidants are easy, cost-effective alternative for couples who want to avoid costly assisted reproductive treatment in conditions where assisted reproductive treatment such as IVF should not be the first line of treatment. Let me conclude. Idiopathic infertility is a broad diagnosis, which is really a big burden for couples, for young couples. And current practice for treating these couples with the idiopathic male infertility is not evidence-based. And a lot of clinics, a lot of physicians are just trying hit and miss and just spending a lot of couples' money and effort and time without any kind of success. So we want to have these physicians and these patients know about that there is a good alternative that is available right now, and which has been proven by the science that they provide very good results for category of patients where they have a high levels of oxidative stress. Those are the patients which shows remarkable results, remarkable success. This really concludes my presentation, and I will be happy later on for any kind of questions. Thank you very much.
Thank you so much, Dr. Agarwal, for that. I am now going to pass over to Dr. Ritz. Can everybody see my screen?
Wonderful. Thank you, Eloise. Thank you, Dr. Agarwal. Thank you for this wonderful opportunity. I'm the medical director of Elite IVF in Houston, Texas, and we had a long trend of performing IVF in easy and difficult cases. The surprise comes that sometimes you have good embryos and you put them back and they do not take. That means they do not implant. So one of the challenges that every doctor and every couple faces is that here you are, you decide with your doctor that you are doing IVF, say the tubes are blocked, somebody has tied her tubes, say that there is somebody with advanced endometriosis and you do IVF, but you put the embryos back and they don't take. So couples are naturally disappointed, doctors are naturally frustrated, and everybody is not winning. So we're looking at the reasons in which when we move to putting one or two normal blastocysts, which are the end stage of the embryos in the lab, and replace them inside a normal healthy uterus, and still no conception occurs. This is the scenario on which I am basing my talk to you today. It's the other spectrum of what Dr. Agarwal talked about. He talked about male fertility, improving counts, and motility. We're talking here about couples who have gone through ART or are going through ART for whatever reason, but they had no luck after replacement of embryos that has been genetically tested and found to be normal, and at the same time, the uterus has been checked and found to be normal. So what are the reasons for these issues? There are a number of reasons for failure. That reasons sometimes have to do with hormones. That reasons have some to do with the environment itself in the uterus. That reason has sometimes to do with the embryos themselves, that although genetically they are normal, but they are showing some other problems. In short, in the next few minutes, I'll tell you what we try to do. We did a prospective clinical trial, means prospective that we go forward from that point, and clinical trial meaning that these are our couples of our own patients that are going through IVF in Texas. During the 3 months before the treatment, we gave them all antioxidants. I'm very grateful for Dr. Agarwal for introducing you to FH Pro, which was the antioxidants of choice for us during this particular trial and in other situations as well. But we always like to have a comparative group. Comparative group means somebody else in which they do not use those antioxidants, and they try to figure out, do they do the same? Do they do better? Do they do worse? So we can compare the same patients to the last 2 years of our same IVF, and I'm the director of the IVF lab as well as the medical director. So there has been no change in the doctor's expertise and no change in the scientific expertise. We included all patients from the age of 18 to the age of 39. Patients who are 40 years old were not included because basically there could be other problems with their fertility issues like small number of oocytes, etc. And we gave all those women antioxidants for 3 months before. So we gave them FH Pro, 6 capsules. You see the blue and the red, and the red are for the ladies and the blue are for the gentlemen. And we gave them 6 capsules for 3 months prior to their IVF. If the patient had a, God forbid, cancer, had a car accident, had issues like that, we excluded them from the trial. And to be able to be fair, we compared them with a similar age group in the same lab, in the same town for the previous 2 years. And I was very excited and proud to say that we have just presented in the last American Society for Reproductive Medicine meeting, which was in October of 2021, the results of our trial as it concluded to its first part. So we actually took in approximately 2,000 or 3,000 patients, but eventually there was approximately 150 patients that went through IVF and were willing to take the antioxidants and did not have a reason for high inflammation or a reason or cancer or accidents or major trauma or major surgery. And we gave them all, with their consent, 6 capsules a day of FH Pro. And then we looked at their fertilization after the ICSI, as well as at the development of blastocyst, which, as many of us know, is the end stage of the embryo in the IVF laboratory, like 5 or 6 days after the egg pickup date. And we compared them to 2 years previously, two years of women's treatment in the same center, same doctor, same lab, same scientific director, and so forth. In summary, we found that there was no difference in the number of eggs, and there was no difference in the fertilization rate. But there was a significant difference in the clinical pregnancy rate. Clinical pregnancy meaning that when you do ultrasound after the IVF, you see a gestational sac inside the uterus. and also in the continuation of the pregnancy, meaning that those women did not just have a sac on week 6 and then they miscarried immediately. They continued and they eventually delivered a healthy baby. So in short, the use of antioxidants for 3 months prior to IVF in women between the age of 18 and 39 resulted in no difference in the number of oocytes, in no difference in the fertilization rate, but a significant increase in the clinical pregnancy rate and the live birth rate, as well as in the blastocyst formation, which, as I mentioned, are the embryos on day 5 or 6. This study is considered to be a pilot study, meaning that the data from it were very encouraging, to the point that 2 things happened after it. Number one, we offer it as a treatment to the patients for in vitro fertilization as a routine. And number 2, we want to do a larger multi-center prospective randomized, meaning that going forward, we say patient number 1 take the antioxidant, patient number 2 does not. This will be the final proof that this is one of the ways to decrease the chance of failure after putting all your efforts and all your resources in doing a good IVF cycle, but at the end resulting in a negative outcome, which is again very frustrating for both patients and doctors. So I would like to conclude here and open it for your fantastic discussion and questions. That my main conclusion is that we did a clinical study where we have proven in going forward over a 2-year period and comparing it to patients over the previous 2 years, that the use of oral antioxidants as FH Pro on a daily basis for 3 months prior to the IVF resulted in a significant improvement in clinical pregnancy rate and live birth rate. And thank you so much for your kind attention.
Thank you so much, Dr. Ritz. That's amazing to hear about studies, especially the comparison before and the results afterwards.